Hello, I'm Dr. Helen Pensanti, and welcome to Doctor, where medical conversation meets everyday understanding for you and your health. Today, we're going to be talking about angina pectoris, a common condition where the heart muscle doesn't get enough blood and oxygen, and usually the coronary arteries are narrowed. The result is chest pain or pressure, often brought about by exertion or stress. Though frightening, angina is a warning signal, and with proper treatment, patients can live long and healthy lives. To help us understand what it is, Dr. Bryn Henderson, a board certified physician and leader in regenerative medicine, is here to help us. Thank you, Dr. Henderson.
Well, thank you. It's a privilege to be here.
What exactly is angina pectoris?
Angina is a chest pain or discomfort caused by an imbalance between the heart's oxygen demand and the oxygen supply. Most often, it happens because the coronary arteries are narrowed by atherosclerosis, and patients describe it as a pressure, a heaviness or tightness in the chest, sometimes spreading to the arm, jaw, or back. It typically comes with exertion or stress and goes away with rest or nitroglycerin.
All right, let's talk about the different types of angina pectoris.
The stable angina is the first type. It's predictable with exertion or stress and relieved by rest or nitro. Unstable angina, now new, worsening, or occurring at rest. This is emergency and part of an acute coronary syndrome. The variant, which is the third type, is a vasospastic angina caused by the spasm of the coronary arteries and can happen even at rest. Other forms, such as nocturnal angina, that happens during sleep, angina decubitus when lying down, or post-infarct angina.
All right, can genetics influence angina risk?
Absolutely. Family history is a major risk factor. People with close relatives who had early heart disease are more likely to develop angina. And on the developmental side, variations on how the coronary arteries form can influence that risk. For example, if a person is born with fewer natural backup vessels, they may have less reserve blood flow. These differences don't cause angina directly, but they make it more likely when arterial disease develops.
All right, what are these backup vessels that you're talking about? Person is born with fewer natural backup vessels?
Yeah, backup vessels.
What are backup vessels?
Those are what you and I call normal ancillary vessels that we have because the collateral circulation takes over when there's not enough blood going through the major circulation.
All right, let's go on to traditional Chinese medicine. How do they view it?
Angina is described as a chest obstruction or heart pain. It's explained as blood stasis, poor energy flow, or imbalance of body systems. Treatment combines herbal, acupuncture, and lifestyle adjustments to improve circulation and reduce symptoms. Modern studies suggest that when TCM is combined with Western, patients have fewer attacks and a better quality of life.
All right, so a person comes into your office. How do you diagnose angina?
We start with a patient's story. The chest pressure or tightness with exertion are relieved by rest.
All right, and what tests do you actually do in your office?
Well, we have conformational tests, exercise or stress testing, treadmill or imaging to see if your heart gets enough blood. Then you can send out for CAT scans or invasive angiography to directly look at the coronary arteries. Risk assessment, combining symptoms, test results, and medical history decide on the best treatment plan.
So, standard of care today in the United States for angina?
Treatment has at least two goals. You want to relieve the symptoms and prevent heart attacks. I would add that you've got to have them in rehab. You've got to be diligent and compliant with their rehab. Medications, beta blockers, calcium channel blockers, long-acting nitrates all relieve chest pain. Short-acting nitroglycerin works quick and helps on the sudden attacks. Statins, aspirin, and blood pressure control lower the risk of heart attacks. Procedures when symptoms persist or arteries are severely narrowed, doctors may recommend angioplasty or stents or coronary bypass.
All right. Well, what about regenerative medicine? What are the new therapies for angina?
Well, we definitely have them, especially for patients with refractory angina. You have symptoms that continue despite all standard treatments. Boom, we put it right there in the heart. We can inject the regenerative cells through new vessels and improve blood supply. They grow new vessels. Studies show improved exercise capacity, reduced chest pain. Exosomes, the tiny vesicles, get into the nicks and crannies where the big ones don't get in. These may one day provide cell-free therapy with fewer risks. We're using it now. These are still investigational, but they offer hope and make sure they stay on their rehab.
All right. Lifestyle. What are they?
Lifestyle central to the treatment. Exercise, regular walking, or cardiac rehab under guidance. Diet is heart healthy stuff. Eating fruits and vegetables and whole grains and lean proteins. Quit smoking, by all authorities say that. And manage stress. It's a lot easier said than done, but relaxation and counseling can help. Medication adherence, keeping nitro on hand and taking prescribed medicines regularly are a good idea.
And the long-term outlook?
Very good, actually. With treatment, many patients live full and active lives. Stable angina itself isn't usually fatal, but it signals underlying coronary disease. And outlook depends upon how well risk factors are managed, like cholesterol, blood pressure, and diabetes. You have to be proactive with a healthy lifestyle because it makes such a big difference.
And your mnemonic for angina?
It's the word pain.
P stands for?
Pattern, stability, or unstable with variant. Those are the patterns we have to know.
A.
Angiography and testing to confirm.
I.
Interventions, medicine, stents, or bypass.
N.
Nurture the heart, lifestyle rehab, and risk control.
All right. Thank you, Dr. Henderson, for taking us through angina pectoris, a condition that is common and sometimes frightening, but very manageable with the right approach, and I would say the right doctor. If you or someone you know has chest discomfort with exertion, please don't ignore it. Get evaluation early. With medicines, lifestyle changes, and these new therapies, regenerative medicine, angina can be controlled and heart health preserved. So thank you for being with us. If you would like to see Dr. Bryn Henderson in person, I encourage you to call 714-639-4013. His office is at 615 East Chapman Avenue in Orange, California. That's in Orange County, California. And if you'd like to get in touch with me, go to my website, www.askdrhelen.com. That's www.askdrhelen.com.